also manage the reprocessing departments in Buren and Clarenville.
So what did you do, actually, during the pandemic?
Well, I guess I did a little bit of everything. I had various tasks, and I had the help of the entire materials team. We all worked together. We helped maintain inventory levels in hospitals and long-term care facilities, and like Lynn had mentioned in infection control, we ensured the PPEs were in place and the isolation carts were stacked. I worked with community health managers to find suitable locations for the immunization clinics in both Buren and Clarenville. We moved supplies and equipment as needed from clinic to clinic. We ensured the supplies and equipment and signage was always available. And I guess we coordinated the pickup of sharps at the clinics. And sometimes we even ordered the food for the staff working at the sites. We arranged transportation for vaccines that were sent from site to site. And really, I guess I was kind of a support person for community health nurses, managers. At a time, they probably needed someone they had so much to do themselves and so much coordinating and planning of their own to do. We have great staff working in materials. The buyers, storekeepers, MSAs, and office staff all had a role to play.
And I hear you actually got in your truck one day and just took it because there was nobody else to do it.
Yeah, we did whatever was necessary.
That's what it was called. Whatever was necessary was done. What will you take away? How were you impacted? What will you take away from this experience?
I guess the biggest thing that I was really proud about is that we all worked as a team, and it made me realize what a great group of managers and staff we have working at Eastern Health. The entire region did come together, and it worked. And people really appreciated what you did and the role you played. And it wasn't about my job or your job. It was about whatever you could do to accomplish the task. And like I saw so much, I saw nurses out bending over for hours giving vaccinations at the clinics, and they didn't want to stop to take a break because there were lineups. And I watched buyers and storekeepers and MSAs ensuring that supplies were always there when needed and as needed. So that's the most thing I know that our staff truly care.
Okay. Thank you, Elizabeth.
Welcome.
I remember reading in the newsletter on H1N1 that the IM&T staff had to stretch their creativity going into some sites that we needed to set up for vaccinations on a very short period of time, and that these sites didn't even have a phone line, let alone internet access, and then have to turn around and try to register people in these sites within a couple of hours. Dave Mills is here with us in St. John's, and he works in our IT department. Dave, are you there?
Yeah, I'm here.
Can you tell us what your job is and what you found yourself in this
site. Terry's here. She's been trying to get in her words. So can we go back to Terry?
Absolutely, we can go back to Terry. Terry, you there now?
Yes, I am.
Oh, hi.
Hi.
This is the lady whose picture we see in our pandemic supply posters. So Terry, I had indicated, is here in St. John's. Terry, you're the one that was on the ground that was right at the very start when we looked at setting up this warehouse. Can you talk to us about getting that warehouse up and running?
Can you hear me now?
Yes, we can, Terry.
Okay. Well, the stockpile at the warehouse started early in the summer.
Yeah.
I never actually went to the warehouse until October. We had to reorganize a massive amount of supplies in order to get things up and going. We had to make the medical kits for the immunization clinics, the doctor's offices, the ambulances, and the schools. I
hear you work really long hours to make all that happen.
Yes, we did. We had a lot. In order to get the kits ready for the clinics, we had to know when the clinics were going to start.
Yes.
No notice for anything. We'd get a phone call, usually 3:45. And then we'll be working way into the night to make sure that the supplies were there at the different clinics for the next morning, or at the schools, or wherever they were having them. Lots of tractor-trailer loads of supplies coming in and going out.
Yeah. What are you most proud of when you think about that warehouse and how you were able to support all parts of Eastern Health, everything from Buren to St. John's?
I think I'm most proud of the way our team worked, from the truck drivers to putting the boxes together, the kits, just the way we worked together. Everybody was jumping in and going in at the major task if there was one priority, because there was always something that had to be ASAP. Everything was ASAP, and some priorities were more important than others, and then just jumping in together and getting it done and moving it out. That was basically what we had to do a lot of.
Okay. Thanks, Terry. Dave, can we go back to you now?
Yes, sure thing.
Okay, so tell us about what you do in your normal day-to-day, but what you found yourself having to do.
Right now, systems analyst with IM&T. Support computer systems every day. However, the last 3 months, I've been mostly involved with the clinics, being at the clinics. So the first few weeks, when this all came about, my major role was to set the computers up, get them ready. We had to connect them to the mass immunization registry. So we had about 70, 80 computers that needed to be configured in a very short amount of time. Managed to get it going. Then we had to provide some training for the staff, to connect to the registry. And once that was done and everything was in place, I spent the rest of the time just supporting, going from site to site, making sure everything was still up and running. So
I hear we're the only region that had to use air cards.
Yes. Well, you touched on the biggest challenge that we faced. We were regional, so a lot of places didn't have internet, like you said, didn't have phone lines.
Yes.
So we had to get a bit creative, and we used cellular internet cards. And a lot of people use them now, so it actually worked out quite well, I feel. In other places, the schools, when we went to the schools, we were lucky that the school boards were bending over backwards to help us. They let us get onto their internet. In some cases, we actually had to call internet service providers and get them to come in and set up our own, personal internet line. So, in actual fact, every place we went, we ended up getting full internet. So, we're pretty pleased with that.
Absolutely. The OCIO, for those who don't know, is the Office of the Chief Information Officer, actually gives kudos to Eastern Health for coming up with that solution and being able to have that connectivity throughout the entire region. So congratulations on that creativity, and that's what we need in Eastern Health.
Thanks. Yeah, it worked well. It worked out well.
Yeah. What will you remember from this experience?
Well, it's the first time that I've ever been involved in anything, of this scale, and I'm amazed at how everybody can just come together and make something like this work. It blows your mind, really. So, people from all different areas of the organization, from us computer guys to nurses, to everybody. And I'm pretty proud to be a part of it. So I'm just going to take that away,
Oh, good. Thanks, Dave.
Oh, you're welcome.
Yeah, change was just not another word. It was something that we worked with and lived with every single day, especially when it came to that vaccination program. We had one of the things that we hadn't anticipated was going to be the vaccine supply shortage. But despite the changes in vaccine criteria that we had to deal with almost on a daily basis as we started, the people on the front lines at the mass immunization clinic, we had hundreds of dedicated nurses who made these adjustments and vaccinated an incredible number of people. Lori Holloway, are you there?
Hi.
Hi. Lori was one of those nurses who worked in the mass immunization clinic, and Lori, you're in Bay Roberts, right?
Yep, that's right.
Can you tell us what you normally do, and then where did you end up doing your job as we went through this fall?
Well, actually, I was hired as a casual nurse only about a week before the pandemic started, so I was getting orientated into the program, and then the week after, obviously, my orientation ran short, and I started in with this.
Very good. And how did that go? What was the experience like?
Pardon?
What was this experience like?
It really showed me how well everyone could come together as a team and work well as a team, and something that you don't always see how everyone can complement each other.
Mm-hmm.
So it was a positive experience for me.
And what were the challenges of working every day doing vaccinations?
I don't know. The biggest challenge, I guess, was it wasn't so hard for me as it was for, I think, a lot of other people who had small children and families that they had to look after. So I guess for me, I was just trying to be accommodating for people, and I probably worked a little bit more longer hours for someone who had a smaller child.
Okay. Yeah. What will you actually take away from this experience?